Hi, everyone. My name is Anish. I'm the CEO and co-founder of Gentle. I wanted to start today off with a personal story. 2 years ago, I lost my ex-girlfriend to suicide. I was sad. I was angry. I had watched her try countless different medications and numerous different antidepressants and therapies, but nothing provided the relief that she needed for her depression or bipolar. She's not alone. In fact, 1 in 8 Americans experience a depressive episode annually. That's over 280 million people globally who struggle with this. I wanted to know why people like her struggle to find lasting relief. And so I looked. And what I found is that treatment today is stuck in the past. And this manifests itself in two main ways. The first, today's at home treatments are antidepressant medication, and they work primarily by targeting serotonin. While they're effective for some, they're far from ideal. Patients have low efficacy rates, they come with a myriad of side effects, they're addictive, and withdrawal can be a big problem when getting off of them. Magnetic stimulation is the most effective treatment we have today, and it works by increasing brain activity. However, it's costly, it's exhaustive. Patients have to sit under this loud magnetic coil for hours a day for weeks on end to get help. And this disruption of their lives can cost up to $40,000. Patients are constantly making sacrifices between their conditions and their treatment. We wanted to build something kind. We wanted to build something gentle. And so we've done that. At Gentle, we're building a headband to provide relief within 30 days, drug and side effect free. We're doing this by bridging the gap between these two types of treatments. Our headband increases brain activity in the area of their brain responsible for mood while maintaining the convenience of an at-home antidepressant. Patients wear a device for 30 minutes for 30 days to treat their depression. It's safe, it's effective, and it's designed to seamlessly integrate into their daily life. Here's what our device looks like. It's upside down. Putting it on is as easy as wearing a headband, and with a few taps, patients can start their session and providers can track their care wherever they are, ensuring a safe and supported experience. We generate revenue through a one-time device purchase and remote patient monitoring billing on the provider side. We already have $1 million in pre-commitments through NYU and Technical University of Munich, our academic design partnerships. Our technology is reimbursable in Europe, the UK, and Canada. I bring a background building complex software platforms, being early at Imprint, working at Bloomberg. Andrew, our co-founder, CTO, leads hardware development with his background building CAR T-cell therapy at Solaris and robotic surgeries at Verb. We're led by clinical experts like the director of NYU and the director of Technical University of Munich who bring decades of experience in this type of care. On the commercialization side, we're led by experts who have built and scaled hardware companies and navigated complex regulations, like the ex-head of product at Google and the ex-head of technology at Philips. At Gentle, we're imagining a future where managing your mental health is as easy as wearing a headband. Thanks so much for your time. If you're interested, let's connect after the presentations.
Now introducing John Rinaldi.
John,
Hey, dude, great job, man.
thank
Really
you.
awesome.
Thanks for being such a great mentor.
Yeah, dude, it's been awesome working with you. However, the stuff that you show oftentimes can be met, and I'll be honest, my first result kind of reaction to it was skepticism. And the reason why is oftentimes products like this sort of feel a little bit pseudosciency. What do you do when someone asks you that question? I know the answer, but I'd love to hear it from you about why this isn't pseudoscience.
Yeah, so I'm gonna take this off. Um, it's quite comfortable. I just um,
It
yeah.
is. I tried it earlier.
So our technology kind of started off working in tandem with Dr. Charvet out of NYU. We wanted to make sure we built something from the clinic. And so, you know, she pioneered the first US clinic to really offer this type of care, and the results she got was really groundbreaking. Dr. Vogelman, on top of that, has conducted numerous trials also, and just the findings are quite phenomenal. Basically, I guess what I'm trying to say is our claims and our scientific basis comes from years of randomized clinical trials, rigorous analysis, and we're on our path to conduct some of our own for ourselves as well.
I saw a few others after we talked. I went and researched. There's a few others that look similar-ish that are sold, I think, primarily in maybe some other countries. So could you just kind of talk to me a little bit why your product and your vision is a little different, and why your go-to-market approach is different than some of your competition?
Yeah, so we designed our product and with the patient and the provider in mind, with the sole focus on making something for depression or mental health. A lot of these other devices are quite frankly quite clunky. Think like, I guess for everyone in this room, think the brain scanner from like Marty McFly's, um, Back to the Future reference. But I think people don't want to wear that. They don't want to wear that even within their house. We wanted to make something that felt like it could be worn anywhere, that didn't carry this weight and this burden with it that I think a lot of these other devices do, especially when you're tackling something so sensitive and important as depression.
Yeah, I've seen these products that have been used in clinical settings that they send home with patients, and you're totally right. Like Doc from Back to the Future, it's big, it's bulky, and I think you're right. Like I don't think a lot of people want to even be seen in their own home wearing that, let alone going outside. I mean, your product looks like something I could just kind of go get a coffee and wear it and not have to be judged about me wearing this product. So I think you've done a great job there. Um, so, talk to me a little bit about where we go next. What's your vision, and where do we take the business from here?
Yeah, so since starting Techstars, obviously we have our pre-commitments. We've built our first device. Come try it. Um, But, you know, our goal really is to be born to be used by millions. And so I think that starts in building a product that is scalable from, mom and pop, like independent psychiatrists to large healthcare systems. On top of that, we are looking to partner with digital clinics, leading MSOs. I think, a few of them could be brands like, Hims and Hers or Row, where that offer to care digitally can easily go to millions. And so um, that's where we want to go with depression. And on top of that, our neuromodulation techniques have been studied and are pretty effective. There's pretty compelling early evidence in things like anxiety and substance use. So we're very keen on exploring those areas as well.
And when you think about how you go to market with this, I think you're saying like mostly through clinicians versus direct to consumer or something like this, where trust is so paramount. I know FDA is kind of part of that too, but you have an easier way to get through that process, I think, based on how you've looked at it through other products that have been worked at through your clinical advisor. Could you kind of just talk to me about a little bit of that?
Yeah, so it's already reimbursable by like Health Canada, for example. In Canada, your insurance will cover it. And then obviously in Europe as well. So there's the CE mark that I guess Brexit happened, but the UK still follows the CE mark. And there's a few competitors kind of pushing the way forward with these, again, these like really bulky devices in the States. And our goal is to do like a 510K piggyback or just, kind of pull off of that and showcase equivalency rather than like a de novo, this works and it's safe.
And I think for those that aren't familiar with the FDA process, that 510 process takes a product that has already been cleared and you're using it for a different purpose, using some of the clinical studies that have been done before. Is that can you kind of let the audience know a little bit about that process and how that's a little bit easier than others?
Yeah. So normally, there's a bunch of phases. Honestly, Kelvin could probably talk the best about this. But, you have to start with bench testing, and then eventually you can maybe test on animals or people. And then once you get that preliminary efficacy, then you have to do a series of different phases to roll out a drug or a medical device. Because a lot of that road has already been paved, we just have to show that we are operating in a manner that's similar with the same contingent protocols, and we're delivering that same uh, modulation of that same area of your brain.
God, I think totally de-risks the product in that way.
Right.
So thank
Totally.
you. Awesome.
Thanks,
Great job
John.
today. Congratulations.